What is induration in a TB skin test? Imagine getting a tiny shot on your inner forearm and then waiting to see how your body reacts. When a person has been exposed to tuberculosis bacteria, their immune system responds to the tuberculin protein injected under the skin. This response causes a raised, hardened swelling called induration. Induration is the key sign doctors look for when interpreting a tuberculosis skin test. It's not the redness or discoloration around the injection site that matters most, but the firm, palpable swelling that forms beneath the skin. This swelling indicates that the immune system recognizes the tuberculin and is reacting to it, which can mean previous exposure or infection with tuberculosis bacteria. The test itself, often called the Mantoux test, involves injecting 0.1 milliliters of purified protein derivative, or PPD, just under the skin on the inner forearm. Right after the injection, a small pale bump or wheal appears, usually about 6 to 10 millimeters across. The real work begins when the site is examined 48 to 72 hours later. During this time, the immune response develops, and the induration reaches its maximum size. Healthcare providers measure the diameter of this from swelling across the skin with a ruler, carefully palpating the edges with their fingertips to get an accurate measurement. The size of the induration helps determine if the test is positive, but what counts as positive depends on individual risk factors. For someone with no known risk factors, an induration of 15 millimeters or more is considered positive. For people with certain risk factors, like recent immigrants from countries where tuberculosis is common, injection drug users, or residents of high-risk settings, a smaller induration of 10 millimeters or more can be enough to indicate a positive result. For those at very high risk, such as people with HIV, recent contact with a tuberculosis case, or those with weakened immune systems, an induration of just 5 millimeters or more is considered positive. It's very important to focus on the induration itself and not the redness or erythema around the site. Redness alone does not mean a positive test. Also, reading the test too late, after 72 hours, can lead to underestimating the induration size, which might cause misdiagnoses. In summary, induration is the measurable, from swelling at the injection site that signals the immune system's response to the tuberculin. Its size helps healthcare providers interpret whether a person has been exposed to tuberculosis bacteria, guiding further testing and diagnosis. Always remember to consult a healthcare professional for proper interpretation and advice based on your individual health situation.